Cancer. It comes in many forms. It strikes the old and the young. But now, after years of research, the battle lines have been drawn, and science is winning. Find out about new treatments available and ways to prevent it on Cancer. Conquering the Enemy Within, presented by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes, and thanks for joining us. You know, most of us have had a close family member or friend diagnosed with cancer. It's estimated there will be over 1 million new cases of cancer diagnosed just in this year alone in the United States. Approximately 70,000 of those new cases will be in Pennsylvania. Statistics say 1 in 4 people will contract some type of cancer in their lifetime. However, in recent years, researchers have learned valuable information to help fight the disease, and some of that research is taking place in our neighborhood at the Penn State Hershey Cancer Institute. Tonight, doctors from the Cancer Institute are here to answer your questions about cancer. Call the number on the screen. And this July, a brand new home for the Cancer Institute is expected to open its doors to patients. Here to tell us more about it, Dr. Chandra Balani, the Deputy Director of the Penn State Hershey Cancer Institute. Well, you know, the first thing I want to ask, Doctor, is how long has this Cancer Institute been around?
Chuck, the Cancer Institute has been here for the last 7 years. And it has existed without walls within the Hershey Medical Center. And during the past 5 to 7 years, the programs which are related to cancer, such as experimental therapeutics, prevention, treatment, providing state-of-the-art care, have been developed. And the foundation for these programs have been laid. So I think we are now in the process of building a cancer center with walls, which will be the cancer center for tomorrow. It's a major step and a lot of big help for the patients coming up here. Now, you mentioned multidisciplinary treatment teams, and how are they and how do they benefit the patient? So the multidisciplinary treatments bring together the radiation oncologists, the medical oncologists, and the surgical oncologists, along with supportive care treatments, compassion, dedication towards service, and palliative treatments for patients with cancer. Yeah, we can see and what there. We see is that the surgical oncologists and medical oncologists come together and provide the care for the patient under one roof. And this actually allows the patient to benefit from all these members of the faculty which are part of the Cancer Institute. And it also actually brings together the clinicians and the researchers together in the same setting, so that we can take the cancer treatment to the next level. Is the construction of the building, is this all on time? Is everything going according to plan? Yeah, the construction of the building is on time. The building is slated to open in July of 2009. The opening ceremonies will be held on June 27th, 2009, and there will be an open house from 10 a.m. to 4 p.m. And all of you are invited to come and visit. There will be tours of the cancer facility. There is also actually a healing garden for the patients to go and have a quiet retreat. And various features of the Cancer Institute will be focused, and there will also be a wellness fair on that day. It sounds like a lot put in there all in one day. Absolutely. And I know everybody that I talked to, all the doctors here tonight, very excited about when this opens. Yes. Big progress. We are very excited that in the region of central Pennsylvania, between Pittsburgh and Philadelphia, this will be the key facility which will provide care to patients with cancer, or who are diagnosed with cancer, or who will be diagnosed with cancer in the future. Well, we'll all look forward to that grand opening. Thank you, Doctor, and thanks for joining us. At this time, we're going to check with my co-anchor, Deborah Pinkerton, in the ABC 27 call center. Deborah.
Now, joining us is Dr. Henry Wagner. He's chair of radiation oncology for the Cancer Institute. He's going to help answer some questions. The first one is, my mother had aggressive B-cell lymphoma. Am I at risk for getting this specific disease because of family history?
You are at an increased risk because of this family history of getting a lymphoma or a leukemia of some sort. Whether it's going to be a B-cell or an aggressive B-cell or a less aggressive one isn't so clear. And the risk is probably about twice as high as the general population.
Okay, and here's another viewer question. I've heard there are a variety of cancer marker tests for specific types of cancer. How accurate are they?
They are very useful for a few types of cancer, such as prostate cancer in men men, ovarian cancer in women, some testicular tumors in men. For the more common cancers like breast, colon, lung cancer, they can be useful, but only when combined with other tests. You shouldn't make decisions based just on these tests.
Okay, thanks so much, and we'll talk to you a little bit later, and we will be back with more questions later in the show. Back to you, Chuck.
Thank you, Deborah. And when we come back, we'll hear an emotional story of a Dauphin County woman's battle against breast cancer. We'll be right back.